Today we'll be discussing the anatomical and physiological processes that contribute to the production of the phrase "Go Tigers." We must take into consideration that the speaker is a healthy 21-year-old female saying the phrase at a relatively loud volume and that she has no prior respiratory or articulatory complications. This is important considering there will be lower nasal airflow and slower sound production, but little difference in velopharyngeal function as compared to a male. First, we'll examine the process of respiration, moving on to phonation, and lastly, articulation, which all work simultaneously to allow this female to produce the phrase "Go Tigers." Respiration involves the coordinated action of multiple different skeletal muscles. The primary muscles involved in our speaker's inspiratory action are the external intercostals, diaphragm, sternocleidomastoid, and the scalenes. During the active process of inspiration, the diaphragm contracts inferiorly along with external intercostals, which causes the rib cage to expand up and outward. This results in the expansion of the thoracic cavity space and increases lung volume. Increased lung volume creates a lower air pressure in the thoracic cavity than that of the atmosphere, which enables the speaker to draw air into her lungs. Keeping in mind our speaker's vocal characteristics, a greater volume is required in order for her to speak loudly. A greater volume means a greater subglottal pressure produced by limited checking action and decreased braking action time. Additionally, when speaking at a loud volume, the alveolar pressure must be higher than 8 to 10 centimeters water. The respiratory tract carries air to and from the lungs. After air makes its way through the nose or mouth, it travels through the pharynx, the larynx, and the respiratory tracts, then down the trachea and bronchial tree, into the lungs. The reverse is true for expiration, which is typically a passive process. The principal muscles contributing to the expiratory process include the abdominal wall, consisting of the transversus abdominis muscle, internal and external oblique muscles, and rectus abdominis muscle, as well as some of the rib cage muscles, which include the internal intercostals and the triangulus sterni. During expiration, the diaphragm returns to its dome-shaped resting position, and the ribs rotate down and inwards, causing the thoracic cavity to reduce in size and airflow to flow out of the lungs. Various muscles in the thoracic region act against each other with the use of extra energy in order to create these movements.
After inspiration, air fills up the lungs. From here, the air will travel from the alveoli to the bronchioles, the bronchi, then the trachea. When the speaker makes a sound, the air from her lungs is pushed up through the opening between the vocal folds or the glottis. When air is pushed through the glottis, pressure in the larynx drops. This in turn makes the vocal folds vibrate, and the vibration is what produces voicing. During the voicing of "Go Tigers," the lateral cricoid-arytenoid muscle adducts or brings together the vocal folds in preparation for sound production and adjusts speech volume. It is important to note that the cricoid thyroid is more engaged at louder speech volumes and that the interarytenoids aid the lateral cricoid-arytenoid in keeping the vocal folds adducted. For the voiceless sounds, the opening of the vocal folds abduct as the tension stretches them across the larynx. That being said, the length and tension of the vocal folds is adjusted by the posterior cricoid-arytenoid muscle of the larynx. Certain sounds may cause the velopharyngeal port to close or to remain open and to be voiced or not voiced.
Now we will discuss some of the major components involved in the anatomy of articulation. Some of those anatomical components include several muscles of the mandible, velum, tongue, and lips. The digastric, mylohyoid, geniohyoid muscles work together to move the mandible during speech. The digastric muscles increase the distance between the upper and lower jaws, and the mylohyoid separates them, while the geniohyoid simply opens the mandible. In saying the word "go," the mandible extends downward only slightly. The genioglossus muscle aids in the production of the "g" sound as it elevates and depresses the tongue. The elevation and depression affects the speaker's velum or soft palate, where the palatal levator muscle raises the velum up and back towards the posterior pharyngeal wall. Most importantly, the orbicularis oris muscle surrounds the opening of the mouth and facilitates the protrusion and compression of the lips necessary to generate the words "go" and "tigers." The orbicularis oris forms a sphincter at the oral end of the pharyngeal oral apparatus, so when contracted, the lips are able to change positions from puckering to pursing, for example. When the speaker is producing the O sound, the lips become rounded and almost move into a pursed position. It is evident that the orbicularis oris is active in producing the phrase because the shape and position of the lips is altered with each vowel and consonant. This rounding motion is actually a result of the production of the g in anticipation of the vowel o, making the word go a forward coarticulate. G is a consonant-voiced velar stop, which means there's a constriction of the vocal tract, the pharyngeal port is open, it is acoustically less intense, and it demonstrates less sonority than the vowel o.
The word tigers begins with an aspirated coronal alveolar consonant T sound made with the blade of the tongue, which is the part of the tongue just behind the tip, elevated onto the alveolar ridge. We should mention that T is the least sonorant speech sound as it is a voiceless plosive. Stop plosives begin with the occlusion of the oral airway and the building up of pressure behind the occlusion, followed by an abrupt opening accompanied by airflow release and a tight velopharyngeal port closure. The VP is closed since the T sound is an oral sound and not a nasal sound. The vowel I in tigers is considered to be a closing diphthong due to a forward tongue placement of the T that comes before it. This tongue placement also means that the T and I together result in anticipatory or forward coarticulation as heard in the word go. The GERS part of the utterance contains the syllabic consonant and semivowel R, which influences the G sound. The R is a semivowel, also known as a liquid, because it is intermediate between a vowel and a consonant, and is syllabic because it follows the schwa sound of the E. The final voiceless alveolar consonant S is influenced by the rest of the sounds in the utterance, specifically the preceding vocalic R, which causes it to sound more like a Z. Because of this, the coarticulation of the R and S, or ers, differs from the rest of the phrase since it is now carryover or backward instead of anticipatory. As mentioned before, the digastric anterior belly, mylohyoid, and geniohyoid muscles of the mandible, as well as the genioglossus of the tongue, palatal levator of the velum, and orbicularis of the lips, all actively play a role in facilitating the articulation of each individual sound in the phrase "Go Tigers." As we near the ending of this lesson, we can probably all agree that our everyday speech is never given this much thought to. But we do hope that the lesson has changed that. To recap, there are so many different bones and muscles and other structures in our bodies that function together to stimulate the mechanisms which allow us to produce speech sounds. Respiration, phonation, and articulation are among these mechanisms, and without them, it would be impossible to say, "Go Tigers!"